get our next set of speakers up on stage for our next panel this morning. And in this one, we're going to be looking at something we've already mentioned, which is this idea of integrating family planning into existing health services. I mean, it's sort of a statement of the obvious, really. If you have got somebody coming to have their child vaccinated or coming to sort something themselves to a health clinic, why not then have your family planning services at the same point at the same time, not least because of the inertia of somebody having to come back for it. And of course it saves on cost, it makes sense. And this is something we're going to be addressing now. And I was, Mr. Molese, handed this tome, which this is a declaration which I think you organised at the International Planned Parent Federation. And it's a declaration that's been signed by, what, I think it's more than 1,000 civil society organisations. And it's because of the summit today, as I understand it. Can you just give us a little, what was the point of that?
Mainly, it is 1,350 organizations from 177 countries who are saying that family planning is important and critical. It has been forgotten for so many years unnecessarily and unfortunately. We are saying to the Gates Foundation and to the British government, thanking them, but also there will still be an unfinished business. One, integrating it with the overall development, not forgetting that for the coming years, when the MDGs are negotiated, that family planning makes the center of any development agenda, the importance of accountability by all, and the commitment of the civil society to deliver services, to mobilize communities, and also to ensure that governments at all levels, be it donors or recipients, are accountable to their population. Okay. So that's the linkage.
This is clearly saying, look, there's support for this out there. Now, you obviously at IPPF have a lot of experience going back in this subject. How do you improve the integration so that you do get family planning amongst other health services?
Well, you know, IPPF founded in 1952 and going to 60 years, like the Oriental, it is re-examining your life. From the beginning, when 4 brave women founded IPPF, the center was about women's development, not just to get contraceptives. Contraceptives allows women to empower themselves and to be healthy. With the emergence of the HIV/AIDS in many countries, when we have started integrating services, we have seen doubling, tripling, even going up to fold of the services, because it has reduced the stigma, because somebody walking in just for HIV VCT services will be stigmatized that he or she is going for HIV. When you are going just for family planning, you have other issues, be it STI, be it prenatal or postnatal care. So unintegrated services improves quality, it reduces stigma, and it increases in the efficiency of services. We have seen that in Malawi, where our program through mobile services have managed to increase by 5-fold its services. And now what we are trying to do with this commitment, IPPF is committing itself to triple its services to provide 1.5 billion services by the year 2020, averting 46 million unintended pregnancies.
And just to be clear, that's a new commitment. That is new.
Yes.
Okay.
It's a new commitment. We are committed to work to strengthen the network which signed this declaration of the civil society. IPPF will be working to ensure that it is not just an opportunistic alliance, but it is a sustainable alliance of the network across the globe.
Okay. Bien, Goanas, on that question.